Okay. Let's see. One more minute.
Oh, here, Mac. We're gonna move our chair out. Sorry. We can go with a little arm, like a TV tray.
Do we know? Mark, do we know
You
about
what?
commission?
I don't
Do we
think
know
those anymore.
These, I
TV
don't.
trays.
Oh, yeah. I actually have one at my house. It's a wooden one that I.
No? Do we know about Commissioner Harvey? Is he on the way or anything? So we need to wait?
Yeah, I don't know.
Let me see where I am
He
at.
usually is, yes. So I'm just going to assume yes. Historically, yes. He's on his way. It's just a little late. You can go ahead and begin without him. You're going to have students that'll stop by today for their fourth grade tour. And so we got the pins and chapstick to hand out
Let's see your chapstick.
Okay.
for them. Huh?
We have a chapstick.
Yeah.
Let's check it out.
I like the pins.
Chapsticks from tourism.
Oh yeah, those are so cute.
And so some people want chapstick rather than a
Okay,
pen.
I'm gonna have one. I do have pins.
And so, but this is for you guys to hand out.
Good morning. It's 9:01 and it's time for us to get started on a work session meeting. Today is May 6, 2025. It's 9:01. So we'll call to order. And then after that, we'll do roll call.
Okay. Lori Mon here.
Sylvia Stubbs here and Commissioner Harvey is on the way. So we'll just go ahead and get started. And today agenda item is emergency medical service work meeting with the city's town, county, and hospital district. So,
All right, we'll
Okay.
turn our time over to
Jeremy.
for his presentation. I know behind the scenes, Jeremy's been working diligently to get the numbers
Weird if I turn this.
caught up and true. And
Is it
so,
okay if I just kind of stand here?
do you need a microphone?
do you want a mic?
Oh, I don't want one. If I
Okay.
need to stand right here, I can.
Yeah.
Maybe so it can
Or I
be
can get you a
recorded.
handheld.
That's
That
how
one,
people,
this is the document that I sent out. Okay. Should be the same. I updated it yesterday. Even more than one. We can check. Yeah, we can check. So today, last time we were here, we just really I didn't feel like we had good data. We're working really hard to get all of this cleaned up. I feel like we've got pretty clean data now, especially moving forward. Calls are up this year, as I believe we can kind of see. So I just put this spreadsheet together, and I've been sharing it and updating it as we talked from our last meeting. So far today, until this morning, we had transported 165 patients. Those are ones we transported. So we've also had 44 cancels. So when we talk about the totals, that's how those work. Is because a lot of times we'll get paged on something and we get canceled, or we get, they had a car accident a couple days ago, and we go out, we check everybody out, and then they refuse. We don't get to transport those. We don't get paid for any calls. We can't bill insurance or anybody for any calls we don't transport people on. We don't use that as a mechanism to try to convince people to be transported, but it is the world we live in. And so that kind of just reflects the numbers. I cleaned up the 24 data, and then the 23 is totals. Those are total numbers, but unfortunately, without going through them each line by line like I did with the 24, it would be hard to find out. We can't get the data as clean as we want it without doing those one at a time. So as you could see, that would be like 600 more PCRs we'd have to review. A couple questions that I had came up. I don't know. When I figured out the in-city versus out-of-city, I know the city limits of Monticello because I happen to live here. Blanding, I am a little bit less familiar with. I do believe we're pretty accurate in where those are. We don't have GIS or anything that's like mapping those for us, but we do look at the addresses. And then as we move forward with everything in 2025, we look at every single PCR based on where the addressing is. So we're pretty confident that we're addressing those and getting that. Going over, it kind of gives us the percentage of runs to 100, and then down from there we have our current budget for 2025 at $1,013,090 is what was approved. We anticipate we will collect $503,000. I don't know why that cut off on the print. Oh, because I took the things off. I don't know why. I apologize. The $503,000 is what we anticipate we'll collect in transport revenue. We have seen an increase in that over the last couple years, especially this year with cleaning up our our data or our PCRs. So I feel like we're in this no-win situation because we clean it up so that we can get a higher return from Medicare, Medicaid, or insurance companies, and then the insurance companies are telling us, well, we're not going to pay for this and this and this and this now. So it feels like we just can't win. We can't go up. There was some recent legislation. I think I shared it with you. I can't remember the bill off the top of my head. That is going to require the insurance companies to recognize our ambulance rates. I don't know what impact that's going to have on us yet. It won't go into effect until I think tomorrow is the day that happens. Medicare, Medicaid are always going to be something we just can't control. We're doing everything that we can on our side to document signatures, get everything we need to make sure that our billing is as high as it can be, and that we're collecting on those at a rate that's within reason. Even though we realize that we're probably in about 30 to 35% of billed versus collections. Like today, or this was a while ago, but I think we billed $387,000 since December 15th, and just kind of in our relation to what we actually collect, we've collected $130,000 of that. So, it fits right into that 35%. It's just kind of the standard across the industry. Ambulance rates are set by the state of Utah. We don't get to negotiate those. So we're hoping with this recent bill that passed, we will see some changes in those. Our personnel expenses are always going to be our highest line item. They sit about $768. In contrast to other agencies that are staffing 2 ambulances a day, well, we actually staff nearly 4. We have 2 full-time or full ambulances we staff every single day, and then we have 2 part-time that are staffed as much as possible. So we have Bluff that's not as staffed as we would like, and our LaSalle first responder truck that same situation. During the day, it's oftentimes not staffed because of those. Other agencies, just in hindsight, their budgets are going to be probably at least double what ours are, sometimes triple. So our neighboring communities do respond to more calls, but still only staff 3 ambulances a day, and their budget's $3.5 million. So I believe that we're really doing everything that we can with the funding we have, and based on knowing that we're not going to be able to ever be self-sustaining in the situation we're in. So that does leave us a deficit. Well, with our other expenses, $244,000, it does leave us a deficit this year of $510,000. And we do work diligently to reduce expenses and increase revenues to offset that.
So will you tell me one more time what the 244,000 was for which?
That is, I'm sorry, I cut my numbers off. Those are like everything else in our budget.
Operational.
Operational, thank you.
Okay.
Now you got it plenty warm in here, Lori.
Right?
Plenty
A little
warm for
hot.
me.
I can tell Rosa again. I'll trust her.
So when I kind of put just those numbers at the bottom, the 2024, 183310, that's when we just take that simple math and we just divide our budget, the 1,013,000, by the 588 calls that we ran, and that gives us a number of about $1,800 a call. Again, in hindsight, when we take those same numbers, even though they have a much higher call volume in our neighboring communities, Cortez and Moab, for instance, their per call budget sits around $2,000 to $2,300 per call, if you take those kind of numbers with them. So again, we really feel like any ideas that anybody has that we can use to offset some of these, we are absolutely open to any ideas all the time. But we really feel we're doing the things we can that we can control. And I know, like, everybody has the same problem as we do. There's never enough, and that's the biggest issue. I think the thing that makes this a topic that we really need to discuss is the fact that it is, in law now that it is deemed essential. It is an essential service, just like the police and the fire. So, I think that's the conversation we move into is, how do we offset that $510,000? And then moving forward with what other changes and such that need to be made and happen. Because I know that everybody in this room, has about the same, has the same goals. We want to provide top-notch emergency care for our citizens and our visitors, and then making sure that we're doing everything that we can to do that as efficiently and with be good stewards of the taxpayer money. So, do you have questions or?
So if I can ask this, with that passing of that TRT, because that bill passed, and then, and then the percentages breakdown, and Mac, maybe you want to, because there should be money there that we can apply for that grant to help offset that. How much are we
Is
thinking
this
would that be?
the new one?
Mm-hmm. Does it go into effect July 1 or May?
I think
I
that's
it's still July
It will go into
1st.
effect in July. You have to pass the resolution prior to that, and then the state tax commission has to notify the hotelers.
Yeah.
Of that process. They figure that first quarter from January, so it would be January 1st. On that first quarter, we wouldn't receive any tax increment revenue for that increased request. It'll happen that second quarter of the year, and so we do have to pass that resolution. The doesn't have to go. A lot of times, if you're increasing a tax rate, it has to go to the vote of the citizenry. This one doesn't. It's a resolution that the commission can pass to implement that. I believe it's 0.5% that can go to TRT, but it's split up where if you pass the resolution and you take your percentage, then it also entitles you to the grant.
Right.
So the state will receive part of that TRT, stick it in a grant pool, and then we can apply for those grants. And those grants are only eligible for EMS, emergency service, the policing, fire, and so that they've kind of restricted it to that one first. And so UAC is working on a resolution. That was one of the things that came out of that legislative conference is UAC, how about you guys draft a resolution that all counties can kind of plagiarize and copy so that we're all kind of asking for the same thing in our resolutions. And so that I would look forward to that here in June to make sure we get that passed and notify the tax commission that we have in fact passed that.
When I sat with UAC and we kind of figured, I think out of, the general, how much money are we kind of thinking we can get on that grant
The grant
offset.
itself,
To ask for
that
the
one's
offset.
kind of a free for all, so it kind of depends on.
I think it's
Well-
$8.5 million a year, if I'm not mistaken.
Yes, but
Right. for
our
him.
percentage,
Right.
but our percentage, then I mean, let's just say we're at 1.2 million for the TRT, and then my understanding is about 625,000 of that has to go, with the tourism department.
Correct.
Then it's that gap there that we
Okay.
get that
Okay.
for that grant. So
It's maybe a couple $100,000.
I would think even more like 3 or 4, but I don't know.
Yeah, I would hope. When we looked
Yeah,
at
that's what I had looked
0.5%,
at.
So we looked at, there's another tax that we haven't applied here. I think the only one in the county that's applied for is it's like a hospitality percentage. Grand County has participated in that, and Bluff, I think, is the only other entity that receives that collection. And so there's actually 2 that we can apply for to push our percentage up a little bit higher. And that's a harder tax because it's based off of a sales tax. And so that one you can pass by resolution as well, but that one actually would hurt your non-tourist citizens, or the citizens in general,
Yeah.
by using that tax. And so we've never requested that hospitality tax. There's also a tax that you can apply for that taxes your ATV sales
Yeah.
in the county, but we don't have
We don't have that.
Sales. So,
Grand County does. But one of the things that we need to recognize is we had kind of just reading the newspaper and watching the EMS traffic out there. Grand County is also struggling to make ends meet with their EMS program. Grand County currently, they service San Juan County with their system all the way up to LaSalle Junction a lot of times. And so they will take those EMS calls for the northern portion of San Juan County. They haven't charged the county for those services. In that article, it had mentioned that one of the commissioners in Grand County had spoken up and had mentioned that, well, maybe we need to start charging San Juan County for the calls that they're responding to, which hasn't happened before in the past.
I did go to lunch with Andy down there, and we discussed that very thing, because of course when I had sent it out and then it got sent back, and we had kind of the back and forth. We both have the opinion that the tit for tat type of negotiations is really not the best way, not the best solution to our problem. When we discussed that with Andy, I mean, he has the same issue. So Lower Valley and Fruita actually covers part of Grand County for them. So after that conversation, there was an email that was sent out to the commissioners that had made those comments and said, we need to look at this as a big picture problem. And the tit for tat thing is really not the solution to our problem, that because I do this for you, now this person's going to have to pay me to do that for them. I think it's, the real big, the elephant in the room is, still, and I think these are great solutions. Like, how do we fund this long term? How do they fund their system long term? And it's unfortunate. I feel like it's unfortunate that, first of all, I think it's really unfortunate that EMS wasn't deemed in law as an essential service until 2022. I mean, most people, if they knew that information, would probably deny that it ever existed, because nobody ever assumed that an ambulance wasn't required to be in your community. And I think that we just took for granted that we had those volunteers for so many years that just did it out of the kindness, mostly out of the kindness of their hearts. And that now a lot of those things have changed. I don't think people have changed, just a lot of circumstances and things have changed that just don't allow people to do that like they used to. But those long-term solutions, which is why we're all here, what do we do long-term to, I hope, my goal with the end of this meeting today was that we were all on the same page, that we don't deny at all that this is an essential service. And, how we work forward to fund it is my number one goal. We can't not fund it. It can't fail. We have to keep it funded. We can't go back where we were. Some days I wish we could. I would love to get people that would work for $1 a day, in the olden days. That's just not feasible with what's required of them now. And so I think we all agree with those things. But that was, my main goal today was like, we're all on the same page, and that it's a group of people within our, it says right in the law, counties and municipalities. So that's why we need the cities here, and our other partners, because it's going to take more than just this one solution to our funding problem. That might work today, but what do we do about next year and the year after? And, coming up with a real long-term solution to this problem is something I feel like we're gonna have to work for.
One of the things with the solution right now depends a lot on tourism.
Right.
And this is not a very good year for us for tourism. We're still gonna have tourism, but the way things are right now with the federal government, and visitors are a little bit skeptical to come, and not only because of the tariffs, but also the cost of airlines cost more to travel to the United States, and also they have their press in those countries, and they kind of make it look like it's not going to be safe for them to travel in the United States. So we had to kind of this year probably not going to show a good amount, but I think with next year, I think things will settle down. We start getting the tourists back.
Yeah.
I think we'll be able to see that, but hopefully the legislature can recognize that this, like you say, is a needed
Yeah.
thing, and we can no longer depend on volunteers, because the cost of housing, families have to have multiple jobs just to pay for housing and food, especially in our county anyway. So it's a good step forward, but we still have to, depend
Yeah.
on tourists coming and showing up our hotels and eating our food, restaurants, and
Yeah.
buying gas.
So on that note, one of the things that we have, we always have, I'm going to use air quotes, thought we responded to a lot of tourist-related calls and such. And we've actually added it to our PCR to collect the data. Was this patient a member of our community? In some form of what the communities we serve. And so we're collecting that data. Of course, it just went in this year, so it's very, very small right now, but we are collecting, that information to hopefully, again, be able to go to other places, the legislature, other areas, and say, we are responding, we're getting heavily impacted by this, and we actually have data to prove it, not just saying we're getting impacted by that. So those things, as well.
That was one of my questions, was that we see more accidents since we have the VERS here, but I guess you guys don't have the data.
See, the interesting thing about car accidents is years ago, when cars were less safe, we saw an increase in injury with accidents. Now we see two things, and some of my staffs here, they could disagree if they want to, and maybe they see something different. When I look at the data, what it shows is we get paged to a call that's very bad. The accident was bad, but because cars are so much safer, 15 airbags go off now instead of just 2. These patients are generally, can be walking around. So what we usually see is, not always, but generally we see walking wounded patients that maybe aren't going to go in an ambulance. They might get transported or go to the ER later just for follow-up. Or we see, catastrophic fatalities or something like that. So those are kind of the spectrum, and we just don't see as much in the middle anymore. So it's really hard to say that there's been an offset based on any factor, especially related to tourism or increased travel. I mean, I travel to Moab or anywhere. I mean, I cannot believe how much traffic has increased in the last 5 years.
Lots of trucks.
It's insane. But to say that, we haven't really seen a spike in those in like traffic incidents that would really offset anything that we would be able to tie down and say, this is an issue.
Well, I actually had reached out to someone from the road department, state road department, because someone had a concern about an area of road between here and Moab. And they said, I mean, yeah, the traffic has increased, but it's got to increase substantially in order to like make some changes in the road. So we see it, but it's like you're saying, I don't think it's not enough to be extremely impactful. But one other question I have is, what if someone from another country comes here, is injured and has to be transported, or whatever the accident may be? Are we able to recoup any funds that way?
It depends. So a lot of times they'll have travel insurance.
Mm-hmm.
So the key is, for us, is to gather as much information as we can, which I work with my staff to do that. Like we went and we used to just be able to be kind of it was just kind of willy-nilly, just finish the report, send it in. Now there are certain requirements when we really need, addresses, insurance information, any of those things that we can gather. We're trying to get that information up front. Because if we don't, I mean, I can't remember the exact situation. It was a car accident. We transported a patient. It wasn't even an out-of-country car accident, and transported them to the hospital. And a couple days later, I was getting it ready to send to billing, and I looked at the face sheet, and there was no information on it. So I called the hospital and said, hey, do you have an updated face sheet? And they had zippo, nothing. And it blew my mind that they would actually let that patient walk out of their facility for the same reasons that we would like to gather more of that information. So to answer your short question with the long answer, we're working to establish a better system that allows for that. Traditionally, a lot of times we didn't ever collect on those.
I mean, I guess I'm just going to throw this out there, but
Credit cards.
and maybe an idea would be to say, I mean, let's just say I was an out-of-country visitor and I went to my motel or my Airbnb and there was an offering for, hey, here's a policy for accidents while you're in our area for $10 the whole time you're here, whether you use it or not. But I mean, it's something here and there to guarantee that there's, I mean, that they're purchasing some sort of policy for their safety.
Right.
I mean, it's just an idea throwing out there that maybe to look into somewhere down the line, because that's nice. Because I know that when I travel out of country, I mean, my insurance is to me like, good luck, you're on your own. So, but I don't know, just a thought.
I have a couple copies of this. I want to make sure that the commissioners get some. I might have a couple extras. We had a company come in prior to any of you guys being here. You were here, but I don't think any of the current commissioners were there. They came in and did an assessment on our EMS system in August of 2022. A lot of the things, honestly, I pulled this document back out when I got this position and started looking at it and trying to figure out, the things we can change, what can we do that would help us implement. But it goes through a lot of the things. In fact, some of the data that was confusing in the email I sent out with the additional, it goes in and talks about what the actual cost of, our system is. And when you talk about, like salary costs and the volunteers, we still have volunteers. Everybody, that works for us now, the highest paid that somebody makes just to be on call is $8 an hour, and that's our paramedic who's put over 2,000 hours into their education. Our EMTs make $3.33 an hour. So we know that they're still volunteering a big chunk of that. So it has a lot of information in it. And some of it, I think it's valuable. The other thing that it did point out is transfers being a big thing. We have been able to take a lot more of those transfers. And as you can see by the numbers, like we use Blanding City, for instance, with their, I mean, in 2010 they had, or 2024, sorry, they had 210 calls within the city limits that we mapped into that area. But over half of those, 123 of those calls came out of the hospital. So those patients are going somewhere else. So, it's not really just a burden for, Blanding City for their community. I mean, the hospital itself is transporting those 100, I mean, half of the patients. And the same goes for, San Juan, in a much smaller scale, but inside the city limits, I mean, 77 calls, and then 50 of those. So more than 50% of those are getting transferred out.
Some of them are transferred from hospital to hospital too, though, right?
Correct. So that does account for hospital to hospital. So usually, Blue Mountain or San Juan to Farmington or Grand Junction or Provo. Those are the three places we're going to go with the ambulance. If anywhere else that patient would go, and it doesn't break it out. This doesn't account for the ones that are going to the airport. So any patient that leaves their facility is what that number represents. So one of the things we did start to look at, and I do have it on another sheet, of where these patients come from that come into the hospitals as well. Not that it is really, it's just more geeky information for me, as we get a lot of patients that come from Dove Creek, for instance, that come into San Juan and then later get transferred out. And what cost does that have on the system and such? So those are things we're also watching. But
Can we ask from cities what they? I guess I'd like to kind of hear from them if we can we?
Yep. Do you have anything else? So,
So you're saying that of the 210 calls Atlantic City has, that includes the Blue Mountain Hospital 123 calls.
correct.
So I guess with the new numbers, what I'm saying, 49% of overall EMS calls are landing in Monticello.
30%.
Well, so I've annualized your 2025 numbers because your average runs, you only having a portion of your 2025. I've annualized your 2025 numbers and then averaged out 24 and 25, which brings it to 33%.
Okay.
I mean, and you're going to see that increase with that annualization.
Yeah.
But it's hard to believe that 49%. And if we do the math in which we were doing before, if we as Blanding City are covering 33% of that, our bill would be $162,000 annually.
Right.
So why would we not just go to the hospital and ask them to start using air ambulance because they don't charge us anything?
That's a great idea, but they actually.
It's a bad idea overall financially for the patient. It's not a good idea.
Right, but the patient cannot get from the hospital to the airport without an ambulance. That's the unfortunate part. I mean, not unfortunate.
It's just what it is.
It's just what it is. Yeah, I mean,
and I understand that, but is it realistic that you want Blanding City to pay $162,000? You want Monticello City to pay $80,000? Is that realistic?
I don't know. Like I said, an ambulance. We know what the ambulance costs based on our numbers. I don't believe so. I think it's a, collective. How do we make this work with everybody? I mean, if you were to hypothetically say, you know what, we're going to go do our own thing.
Well, that doesn't make sense.
Right. No, it absolutely
scale.
doesn't. I'm just saying hypothetically, but you're going to have the you cannot do it for less than $500,000 a year. So, where does it, I guess that's the question is, does it help to take what we can? If you can't give that, that's understand, but take what we can. If somebody can give what they can, those are the things. And then we start to try to offset those numbers. If we can get this TRT tax, then no, I don't believe that, I believe that the cities are participating, these motels and such are in their communities. They're dealing with those, they're offsetting some of those. So I think that the question is just, for me, it's just a global number. It's really hard for me, for instance, to put a number and say, you owe us X. That's not how I feel
Right.
about that at all.
Some of the heartburn is that, for the cities, we already pay a San Juan Health
Right.
Service tax, which originally had EMS involved. They were in a financial stress, and so the county was kind enough to take on EMS.
It was a kind gift.
And now we're looking at being essentially double taxed
Right.
as those that are incorporated.
Mm-hmm.
And so it's hard to pass on to all of our constituents that we're adding this tax. We're
Right.
not calling it a tax, it's more just a bill. And so we talked about the TRT tax, hospitality tax. I completely disagree with the hospitality tax for what Mac had said, that that's more of a burden on our citizens than it is the tourism. The TRT is more of a tax on the tourism, which they do use it. I don't think they use it as much, just like you're saying. But, these numbers keep going up and up and up.
They do,
And,
and they will.
at what point do we go talk to the Blue Mountain Hospital and say, hey, of those transfers, Blanding City's on the hook for that? It just doesn't make a lot of sense.
That's why I broke them out,
Right.
so
and I
that we could
appreciate
see
that. And
everybody
knowing that now makes me feel a little better.
a little better.
I think that's got to be part of the conversation is by law, you have to cover 911 response. A transport from a hospital to another hospital isn't a 911 response, it's a transport. And so the audit had pointed out that, hey, county, you make more money because of the billing charges that you can push through to the patient on a transport. And so we've shifted gears in our pay structure to reward those EMTs that are wanting to take a transport. They get more money because we make more money, and so that makes business sense. But I think that the hospitals, it's not a 911 call. It's we have a patient, can we transfer it there? And so I think they've got to be part of this equation.
And I can agree with that. So as for the transport, so how many of the 123 Blue Mountain Hospital transports are long distance transports? That's where the money is for EMS. It's long distance transports, not Blue Mountain Hospital to the Blanding Airport.
Or Monticello,
Well,
Blue Mountain.
and then
so-
in your same thought process, it actually changes once you go too far away, if that makes sense. Because if we start bypassing a facility that could do the procedure that they're getting transferred for, so a lot of times, say a hospital wants to transfer to the University of Utah because that's where the patient was seen for whatever was happening last time. And so that's the doctor they get on the phone, they get into accepting, and they want to get transferred to the University of Utah. Several years ago, we were actually taking those. We did some collections on our stuff, and we had taken 13 Blanding to the University of Utah calls or transfers. And of those 13 calls, we had put, countless numbers of, hours with our staff, the mileage on our vehicles, fuel costs, all of those costs. When we analyzed what we had actually collected on those 13, all 13, not each, all 13, we collected just about $1,000. So at that time, because we cannot get those paid, because there's 5 hospitals are driving past that could do the stuff that they would do. So we don't do those anymore. And we're pretty selective. So I could break that out. I don't have that exact that number with me. I could certainly send it over, but
I understand
it's
all
certainly
that
lower.
stuff.
It's the lower side of this 123. I can promise you that.
And it is hard. Healthcare is hard. It sucks when it comes to billing and collections. I get that because yes, you can't pass a hospital, but in the air you can.
Right.
But on the ground you can't. So you pass. Moab's even a higher trauma hospital than you
Right.
do down here, and then you have Price and so forth. And so
Right.
I completely get that, but this is just a hard pill for the 3 cities to swallow. Seeing these numbers continually go up, and what is the answer? There to EMS, there's not a lot of answer.
No. Well, that's the problem, in my opinion. The states, and luckily Utah is actually one of the states that does see EMS as essential. There are still states in the 50 that do not have this, that do not actually have EMS as an essential service. So we're grateful for that, because at least it gets the conversation going, and we're having the same problems we've had for the last 5 years. But now we're talking about different solutions. And I'm not here to pass the buck to somebody else, say this is your problem. This is our problem. I feel like we all collectively need to figure out a solution to. I can't remember what I was going to say.
Can I?
Absolutely.
Too bad that we don't have the hospital district here, because they need to be in this conversation. And I think we need to, as a county, we need to remind them what was the deal. You know, they pass us a happy data to us, and we're trying to pass it to each other. And I don't know how much the city pay on fees, but they should not be not having the responsibility in collecting the fees. I don't think that is fair. And so, too bad they're not here today, and I'm sure they were invited.
Yep.
But anyway, so I think that's probably one of the next steps we need to do is just kind of get with them and say, okay, the goal that they were seeking has been accomplished. They needed a hospital. And at that point, they came to the county so that we take the burden from them. But now we are here, and they have their hospital, and we and everybody else is kind of trying to figure out how we can make it work. And I think together, with their help and the county and the cities, I think we can come up with some solution. Like you say, probably will never be the whole solution. Eventually, probably, as I know, lots of the small counties have the same issues, and that's the beauty of UAC. UAC bring all those counties together, and because of that, they can help pass bills or help. But I like this conversation we're having, because it clears lots of misunderstanding that we may have, and we appreciate all the work you have done, and and just bringing this information to us. Commissioner has a comment.
So I don't think it would hurt as cities and county to sit down with our legislative representatives.
That's what I was going to say.
Because I guess this is my thought. So the way the counties are classified, they're classified by population. So we actually are fourth class county by population. And I've had this conversation with a couple of other small counties that you're only classifying by the population, not necessarily by the
The need.
the poverty level. And I said, so it's really hard for us to be classified as a fourth class county based only on numbers, not on the economy and everything within our county. But that might be an approach with the legislation to say, hey, maybe look at these smaller counties with population, but also with the amount of income that's being brought into those counties, and have that conversation and have them help generate some ideas or ways that we could work that actually, help work with these smaller counties. But I think that might be a starting point with Representative Monson to start with. And if there's some way he thinks he could sponsor a bill of any sort and that we could get UAC behind us, but that might be even some funding, an ongoing appropriation.
So one of the things that did happen in this recent legislative session that's really just, it's hard for us. So there's 37, traditionally there's been 37 counties that fit into the 4th, 5th, and 6th range. And when there is some EMS grant funding that's been available for those areas. Last year, luckily, they had a surplus, and so I think they had around $4 million that went into that program. This year, they only have $2 million. The other problem with this year, traditionally, we've been able to secure, which isn't a lot, but we've traditionally secured between $64,000 and $80,000 a year, which helps us offset some of those personnel costs. This year, the legislature passed to include Washington County as a 4th class county. And
Washington and Grant County, they're both 4.
So now we have, so now we're competing against 43 different counties. So this year, for instance, the most, I talked to Mac about this, the most we will be able to get, because we'll apply, we'll get $21,000. That's just to apply. So take the first $1 million and divide that out by the 43. And then we have to be competitive for that other $1 million. But as you can do really quick, easy math, that you can only get I think it's 150%, or they have some formula. So basically you can get a max, the very max you will be able to get for that is $53,000. So traditionally, I mean, we're losing that $11,000 that we anticipated as income as well.
So I know that we've approached the legislators before, and I know Trent was at the regional meeting there in Richfield, I believe it was, with some of the state legislators in the room, and they're kind of doing the same thing and asking those same questions of how do we get more money into rural EMS, and the TRT kind of was that solution this year to get more money into rural EMS. I know that Darren Bushman, the director, he was there as well. Senator Albright was there. Senator Hinkins. We had a couple other senators from up north that came down to listen to everybody within this portion of the state. So the discussion and concerns have been expressed, yet they kind of continue to point to TRT. I worry about TRT in general because tourism, although in this area we kind of are starting to see that downturn of the whole tariff discussion, things like that, have its effect on the hotel with reservations being pulled out. Where tourism is cyclical, it's not a steady answer. What Jeremy's presented today is really covering the hole that we have. It's not a betterment to the system. We were fortunate in this county to receive CIB funds that funded the new ambulances. And we continue to look for grant funding for a transport vehicle. These are all patches to the system. It's not a betterment. It's not, you look at the costs that go into personnel. We want our employees, EMTs, the basic EMT to go up into advanced, and we want to be able to offer those incentives and that reimbursement for them to become a higher educated EMT, working up to the paramedic program. And so all of those, and that's what we use the grant funds for, is really promoting our EMTs, getting them educated and to the advanced level, so that they can take care of people better. But there will come a time when, hey, we've got to replace tires. Hey, we need a new ambulance. All of that isn't in this picture. This is to plug the hole that we currently have, but it's not to better the system. The buildings are going to run down. They're going to have needs within themselves. And so one of the things that hasn't been explored, and Jeremy, I'd like you to touch on this in your responses, what does it look like if we turn this program back to the hospital district?
That's certainly something you could put on the table.
They would have to increase their tax.
Correct. I mean, I feel like all you'd be doing is shuffling the problem. The same. We could shuffle it over here to the city, or shuffle it over here to here. Yeah. I have seriously looked at. Grand County, for instance, went out on their own as a special service district. What does that give us? It gives us taxing authority. This is what we're trying to avoid, is more taxes. So, and the double tax, all of these things, I think they just have. I'm not saying it's a bad idea or it wouldn't work. I do have concern that because we have two hospitals so close together, that if one hospital was the controlling factor in the EMS system, that all their transfers would get taken out because it would be very helpful, and the other hospital potentially has that potential to be underserved because of that. They're just not available. Like, those are some things, and I just don't think that they have the funding to fix this. I don't look at it as a fix to the problem. My personal opinion, I would like to see it stay at the county level. And it might be, I might have a biased opinion. I worked for it when it was in the hospital, and I know our hospital's in a lot better situation than it was. I talked to other directors in the state that have hospital-based systems. Every system has its challenges, and if you've worked in one system, you've worked in one system. When I talked to him about some of our challenges in San Juan County, they're not unique to San Juan County. Everybody has a funding issue. That's the elephant in the room, and the big problem is how do we fund this? But by moving it to a hospital, it didn't. Those ones still have funding issues. I mean, Kane County still has a funding issue with their ambulance. Their ambulance is actually ran by the fire department because they can't afford to run it as a hospital program. So there's a lot of other reasons why, it might be great, it might not. I don't know. And that's a long answer to your short question, but
I just wanted everybody to hear that. Hear your comments on that.
You know, one of the things that when I became a commissioner and find out that we as a county, we're in the same formula as Grand County. Okay, when you go through their main street, I count all the hotels, all the motels, everything they have. And now to learn that Washington County is in the same formula.
Yep.
I was there and I count all the hotels, all the stuff.
Yep.
All the wealth is there. So as we approach legislature telling our situation, it doesn't help them unless they see our situation. And one of the things I had done is invite people to come to our county. Go through Monticello Main Street, go through Blandy Main Street, and count where our income is coming from. And I think that is what is going to help, because when they're talking about formulas and things like that, and you put Grand County and Washington County now against us applying for funds, we gonna lose. And so the best thing is just to basically just show them, have a show and tell, have them and come and see, so that when we are talking, they know what we're talking about.
yeah, those things are the most challenging when you talk about those, because our expenses are the same, whether we run
Yeah,
600 calls a year,
yeah.
or I give Price and Moab crud all the time, because I'm like, what I wouldn't give to have your problems,
Well,
because you run 1,500 calls a year, and I could do it for the same amount of money.
on top of that, our area,
Yeah,
you
Out of
can't
one
just-
station.
It's not like Oro and Provo, you just can go there.
Right.
Over here.
right.
So we have a big
So we have to
area.
plan for a big problem, and we have to staff. I mean, we've talked about that. How could we reduce our costs? Well, we can shut an ambulance down, but which one of those city managers is over there is going to take their turn having no ambulance in their community today? That's definitely a solution. I could get you really close, but it's not the solution to the problem. And like you're talking and comparing us to these other areas is certainly not fair or inconsistent.
And it doesn't get you the equipment that you need.
No.
It doesn't get you the latest
Yep.
technology.
Yeah. Well, and we need to know those. I mean, when years ago, there was a feasibility study done where paramedics were necessary. And if you look at the state of Washington, let's look at two different states. We're not even looking at Utah. But if you look at the state of Washington, they run a system. It's a tiered system. So they don't send paramedics on calls that don't need a paramedic, and then they send paramedics to the ones they do. They have one of the highest cardiac arrest survival rates in the nation. And because of their tiered system, Utah went out there and looked at their system and came back and said, hey, we should do something like that. I think there was, at the time, I can't remember, and I'm going to misspeak about what it was, but it was a very low number. I think there was under 100 paramedics in this system that they were looking at in Washington. And they came back to Utah, and in the same size system, they had 500. And the question was, why do you have such a high survival rate over here, but you have a fifth as number of these paramedics as they do in Utah? And they started looking at Utah and figuring out that actually where they need those, they don't need 2 paramedics to go on a truck in Salt Lake City that's 10 minutes away from a level 1 trauma center. We need paramedics. We need highly skilled people and paramedics and higher educated people in rural communities because of the time periods that we actually spend with patients.
40-minute to an hour.
When I did my fire rides in Salt Lake, to get my paramedic certification, I had to do 500 hours on a truck up there. And I was like and I had a certain amount of skills I had to do. I had a hard time in the short transfer times. I'd have to do certain things, do a certain medication or do some IVs or put a CPAP, do something. And during the short period of time, we would have that. I sent my crew out on a call a couple weeks ago, and they left here at 2:00 in the afternoon, and they got back at 2:00 in the morning. And they were with one patient the whole time, while we were trying to extricate this patient out of, out in the giggle weeds. So the difference between, rural medicine and urban medicine is we're not even in the same hemisphere. But I think we would all agree in here, if you need to call 911, like you want what TV portrays. You want someone that comes really fast and knows all the answers and, fixes your problem. And not that that's ever going to be obtainable, but that's our goal, is to be exceptional at what we do and be able to take care of those patients. And for the money, I think we're doing a really good job, and I know nobody's disagreeing with that. But one other thing, with the TRT grant, I don't know if that's the one, the $8.5 million one that just went through the legislature. The rural, which we're a part of, Rural EMS Directors of Utah Association, can't remember all their,
directors.
they have a lot of initials in their name, actually has secured a seat on that grant board. So we're hopeful. The unfortunate part is that group does represent the now 43 rural
EMS.
Yeah. Which is, concerning, but hopefully that will at least afford us, with the other members all being related, law enforcement and search and rescue, which we love as well, but we want our slice of the pie. So
Does anybody have any other comments or questions?
Solutions.
Solutions?
would be awesome.
I mean, I could all day on this coming from healthcare, but Jeremy, you made a comment that with special services, that's just more tax. That's not what we want. I agree 100%. That's not what we want. But asking the cities to pay, that's another tax.
Right.
Yeah.
So we're already there.
In essence.
In essence, we're already there. And with we hope this TRT stuff and this grant stuff comes out. If it does, then that can reduce a tax rate in a special service district. That can fluctuate each year. I feel like San Juan Health Service District has done a really good job of decreasing that. A few years ago, they were collecting roughly $1 million. I believe this year they'll collect roughly $700,000. So they're reducing their tax rate.
They've always cut their certified tax rate.
So they're doing what we as taxpayers want to see, and as they become more efficient and better at their jobs, and bring in more services, that we're reducing that. So having EMS part of San Juan Health Services, is that an answer? Yes and no.
Right.
No offense to the commissioners, but the healthcare background and the understanding of billing and all that stuff, it's not your forte. Having it part of the hospital system, it is their forte. That's what they do.
Right.
I don't know how JCI bills, if they bill percentage of collections, if they bill just a flat rate for each.
They bill us a flat rate.
So they bill a flat rate. So
It's the state rate, and that's the difficulty with
right.
it.
And so, is there a way to negotiate a contract with them, a percentage of collections? They need to fight harder for you. With the EMRs that the hospitals have, well, at least Blue Mountain Hospital, where I came from, they only got paid on what they collected. We didn't pay them a flat rate for every patient that they touched. It was a percentage of collections. I'm not saying that's what JCI would be open to, but we talk about the tourism. We talk about those things that the pay sheets that not gathering the insurance. That's a common thing, unfortunately.
Yeah.
Happens. And then we have the uninsured that we're not going to see. And so that's a route that why San Juan Health Service District might be a viable option. I don't know if it's the option. I don't know how excited they are about it.
I don't know, and I don't know the answer to this question, but I mean, the greater number of our calls are Medicare, Medicaid patients.
Well, I will give you a lot of credit. I looked at the collections. Mac shared some stuff from JCI with me. Medicare, Medicaid collections looked really good in my opinion because
Yeah,
you're
unfortunately
stuck.
Medicare and Medicaid are horrible at
Yeah, yeah.
You know, they say they pay 102%, but realistically, after fixed costs are taken
It's
out,
only a
it's roughly
percentage.
50%,
Yeah.
or lower. So, you know, could there be better collections from JCI with percentage of collections? Possibly.
Yeah, I don't know. And that's a
Then that reduces your expense. It makes them fight harder
Right.
for us. I don't know if there's another billing
a good
system
idea.
out there that does that, but the
So we have
expert-
two different billing mechanisms. So we have JCI as our first stop, and then anything outstanding that needs to be collected, we have another company that
at a much
collects.
higher and they do it probably a collection
yes. And
percentage.
so that was one of the
Percentage, yeah.
questions I had with the health district is, well, if it transfers to you, then do we get rid of JCI altogether? And they do the billing. The hospital district
could
does
do
the
that.
billing on their own, just how they already do billing. It just incorporates within their system, and then whatever they do for that extra collection services. So you forego the JCI costs, utilizing their own systems, but
Well, and I know in order to transfer it back to San Juan Health Service District, the state would have to get involved. They would have to approve it. There's a lot of steps that have to be taken there. But I see it as yes, they have that. They already have their fixed costs in their billing and everything else that they do. In healthcare, you lose money here to make money here. For example, having babies. Nobody makes money having babies. It's a losing revenue source.
it
But
totally
also,
was.
those same patients go to the
For
ER, they
everyone.
go have surgery, they go to the other service lines which are offered by the healthcare systems. And so this is one more thing. Yes, the hospitals may have to compete with that, but you know, UNHS, BMH, with
Right.
their current merger situation they're having, maybe it doesn't really even matter. But I think these are the things that we need to look at. Special service district, at the very least, if we're talking about the cities having to pay, could be an answer, and having a board on that special service district that has a healthcare background to help commissioners understand a little bit more. And
Yeah.
kind of be that stopgap and bringing it to you. So I think those, in my opinion, are the top two solutions if we're talking about Blanding City, Monticello, Bluff having to pay that. We're already taxing people,
Yeah, you're already doing it under a special service district. It's just not
and that's
there anymore.
Grant County had a special service district. Now, yes, that's another tax. I get that. But that tax can fluctuate a lot easier and a lot quicker on year to year to say, hey, we are doing well with grant funding. We get to reduce it, or hey, we have this deficit and so forth. You know, we do need, and I agree with Mac, that we need to have a surplus. We need to have, you know, cash in the bank for when we do need to buy that new ambulance, when we do need to get that new equipment, stuff like that. The way that we're trending now, it's just not happening. And it won't happen at this rate.
Right.
Even the same uniforms and
Yep.
not having staff going to purchase Walmart clothes so they can sew a patch on.
So let me ask this: would we be interested at all in just having the service district work with the deficit, the gap there, or the whole thing?
I think it would have to be the whole thing. I think you'd have to turn it all over to a special service district. And maybe that's step one. Maybe try that before we get, I mean, San Juan Health Service, unfortunately, they're not here today to listen to the possibility of them. But they've offered money, and I don't know the amount of money, to San Juan County.
I thought it was more like a one-time offer, but
Well,
or is it? Did you feel like it was ongoing?
I
think it
an
was-
annual thing.
Okay.
You know,
I've heard a verbal of 100,000 a year, but I don't know. That was
Okay.
a verbal
right. And
conversation
that's
that I wasn't
another
part of.
heard. But that's still not going to
It's not going
fix
to
Yeah.
the problem.
Yeah.
It's not
Yeah.
going to fill the gap that
and
we have.
or the betterment.
You know, and I'm not trying to get the city out of, you know, the way that the law reads is that we must do it ourselves or contract with somebody to do so. I'm not trying to get us out of that, but I'm just trying to think of across the board from a taxpaying perspective.
So,
We're already doing, we are already paying taxes.
Yeah.
in San Juan County.
so you're gonna end up being double tax. I mean, paying double.
That's the
And
concern.
The three cities,
Yeah.
yes.
Yeah.
Well, and if you move it to correct me if I'm wrong, but if we were to hypothetically move it to its own service district,
Yeah,
you're just going to tax it again.
It'll be
Yeah.
yes, an additional.
but then the hospital doesn't get money.
Right. They're still collecting their healthcare service district tax, and we're gonna have to enact another another ambulance service district tax to offset this $500,000 that we.
Mm-hmm.
So that's what I mean. I don't know the solution. I think it's like pull from one hand to transfer the responsibility to another. I don't know if that's the solution or if it's not. We're certainly open to all things. From our perspective, our only goal is to provide, patient care to the citizens of our community and the people that visit here, and to do that excellently. So.
Thank you for your presentation. I think we probably need to. Oh, you have, okay.
I mean, I'm sorry.
No,
ahead.
no, no.
What
You
time
can.
does your commission meeting start?
Yeah.
No.
We're good till 11.
Oh, I thought it was.
So-
I'm sorry. No, I'm sorry. I thought it was.
So,
I haven't blurry vision because I haven't had something to eat. Truly, I am having.
one way that I feel like EMS does get the right of the deal is they're available 24/7. They show up to a patient. The patient gets to say, "No, I don't want you,"
Mm-hmm.
but yet they still had to show
We
up.
can have Brian.
Let's talk about car accidents, for example. Is Mac, you and I have talked about fire and rescue, and we still have to have those conversations as well. But can rescue? They should be able to bill as well. They're doing more than EMS. EMS shows up and say no. The patient says no to you, but they couldn't say no to us because we had to do certain things. I don't know if JCI has that side of billing. If that's something.
Yeah, we've looked at all of those options. We've even looked at billing for your dead person. We come and work on for an hour at your house, and then we leave them there because they've expired. And to bill that out, we can certainly do that. I could send your family a bill,
I would recommend that even at the hospital.
but it's what's the
just do bill.
difference?
Mhm.
What's the difference?
Well,
And the other component of that is they're a medical billing company, ambulance medical billing company. So I think that they're very specialized in, ambulance billing.
right, and
but-
that's what I don't know.
Yeah, they don't do, as far as I know,
Do fire.
we could certainly talk to them, but I mean, that wouldn't have anything to do with, that would be too separate because we're completely separate
This
from,
company was started
those two
on the
things.
backbone of the EMS billing itself. So
and that's what I do think. I don't disagree, that a hospital could do billing, ambulance billing, but I do disagree that, we are with JCI. They are an ambulance billing company. That is all they do. That's all they do. They don't worry about, other aspects of healthcare. I don't know if it's a big number or not. It doesn't seem like a number to me. It kind of seems almost like a trivial amount. Just really quick calculations. We paid JCI about $17,400 last year to collect the $500,000 that they collected. So I don't know, I don't disagree with the percentage, thought. But we cannot, there's a lot of things, not some things. There's a lot of things that are out of our control. We are stuck at a base rate. That is not negotiable. That is set by the legislature at this rate. If we make money, if all the EMS, this is the other terrible part about how the system's set up. If the state of Utah was to start, EMS systems are to start making money, they will actually decrease that rate. That is how the law is written. We are not supposed to be profitable. So that's a flaw in the system as far as I'm concerned. So our rates are set, our collections are set. Insurance companies are falling right on the the coattails of Medicare, Medicaid, saying, why would we pay you more than 35, 40% when Medicaid, Medicare is not going to do it? So all of those things, and just fighting those insurance companies, yes, maybe with, the hospitals or somebody else as to really go after. Unfortunately, I feel like the person that's going to suffer in all of those equations is, when it comes to right to the bottom line, is going to be the person who called 911 and needed us to come, and their insurance doesn't pay. And then we take a hard line that we're going to come after you for every dime that's owed. That's when they're going to start to, they can fight with their insurance companies, but some of those things are just set. There's legislation that just passed this year. They are going to hopefully have insurance companies recognize our rates. So hopefully we will see a little uptick in that. But with that, we trade it off. We no longer are allowed to bill for supplies. Medicare, Medicaid never paid for them. PHP doesn't pay for them. Blue Cross Blue Shield says, well, if they're not paying for them, why am I going to pay for them? So we get to bill for supplies. So I go run on your person we do transport and we use $1,000 worth of supplies, we only collect the $1,500 base rate and 2 miles of, to transport them there. And then off that, we're going to collect 35% of that most likely. And so all of those things, like that's what I said. I believe it's a very complicated thing. And it's the easiest solution is to say, let it be someone else's problem. And I don't hope the cities don't feel like that's what my solution is. I'm looking for partners. What does the city have something that they could help to offer this as being a partner in the EMS system that does say, the county could say, we're not going to do this anymore. Like they would have that right and it would fall back to the cities. That's not a good solution at all. So I think, that together and collectively looking for that solution is the answer to our problem. And if those other ideas are something we want to explore, let us start looking at some of those as options and then look at the pros and cons of those, because there certainly are some from every side. And then we could certainly decide which of those fits into, the best system that we can make for the citizens here.
So I guess that's my question is what's the next step? Do we just, you guys are going to try and explore some ideas, maybe have a conversation with the health service district and then come back with us? I don't know.
I personally feel if the conversation we have with the health service district, I think it could be an open meeting.
So we'd probably just have another one again, but maybe you can explore some of those ideas and come.
What about Blue
back?
Mountain? Yeah, along with her thoughts, Blue Mountain. You've been internally with them in the past. Do you think they would be willing to pay for transports and things like that, kind of on their own?
I mean, the quick answer is no. Nobody wants to pay for something.
Nobody, obvious.
Yeah.
Right.
It's been talked about in the past with others. I mean, UNHS has their non-emergency transport.
They do, yeah.
So that,
Montezuma,
that's
yeah.
and that pays by mileage, and unfortunately, they pay a lot more than what EMS gets apparently.
Right.
Yeah, they do. Yeah.
Big thing. So there's the non-emergent type transports that they just need to get to the airport, but
They're kind of at a higher advantage, I feel, than our EMS program, just in the fact that what they do is some of the nurses get EMT certified and EMT advanced, and so you'll take in Montezuma Creek, you'll have a nurse that's working, no patients in there. They're allowed to take a hospital or an ambulance run, and then provide that EMT coverage on the ambulance, get paid the same nurse rate while they're out on the ambulance. And so their pool of employees are a little bit more steady than ours are, just because of that mechanism being under the hospital and having that allowance that if you're on shift as a nurse, no patients are there to cover and see, and you're extra, go take an ambulance run. So a little bit different on the mechanism, so they pay a lot more with that. I know that Jeremy wanted, so we've looked at even in our billing, NACO had a program, so the National Association of Counties had a program that in conjunction with the state, where if the individual wasn't a Medicaid, Medicare, or didn't have insurance covers, they're paying out of pocket, and they didn't pay their EMS ambulance bill, then they had a collection program, and we entered probably a handful, maybe up to 10 people into that system, where it would garnish their personal income at the state level. But that program, it wasn't used enough throughout the state, so they did away with the program here in Utah. I know that Jeremy's in discussions right now with Toyok. That's one of the missing components of this as well. When you look at the outside landing city calls for us, White Mesa is a heavy user of our EMS system. We're Jeremy's in discussions with them to try to figure out on their side of it, how much they can pay to help with this problem, because they are heavily utilizing the ambulance system for non-emergency purposes, more taxi rides. And so And then it gets into jurisdictional issues and concerns that we have even going to that area. Yet we feel that it's too far for Montezuma Creek and UNHS to cover where we're closer in Blanding than they are for Montezuma Creek. And so there's discussions with them to try to help eliminate some of this burden. Anything else that we're missing to throw out there?
Say a couple months, maybe. Okay.
I appreciate your being here. Sorry, I got a little bit dizzy. Anyway, I don't like to eat breakfast too early, and then about this time, I just want to need some food.
Well, we don't want to call the ambulance over here.
Well,
so.
I'm sure glad I have you guys here in the room.
I mean, that would be a good show and tell.
I know.
It's one way to get it.
Anyway, I'm excited for what I heard today. So nice to have people with, with ability to have some input for us to be able to fix this. Like you said, probably will never be 100% fixed, because this is when you guys go in the ambulance, you don't have to be worried who's going to pay this bill.
Right.
You have to concentrate on the patient. And that's our job, I guess, to try and figure out the best solution to help you and to keep pursuing the legislature to see what else we can do to improve. And
But I think that's the key, is to keep pursuing really, I think it's a moving target.
Mhm.
I think people know that we're struggling, to do these, to make ends meet. They know that it's a burden now, that's getting passed from the state to the county to the cities to the citizens, to the actual end user. We know all those things, and I think that's the unfortunate part, is they didn't ever put out a funding mechanism. It wasn't there, and it's just something that it just got missed on it was 1985 when this EMS was funded, and then they pulled a bunch of federal funding out of that era, and that's when EMS just kind of fell to the wayside. And and when it was picked up by those volunteers, and we never told the story of why we can't continue to do it this way until now. And now it's became this right now situation, and right now it's a problem.
And you can see lots of improvements, though, with the insurance benefit being offered to people part-time, where they can have not
Yes.
only insurance for the work,
Yep.
for the volunteer, but for the whole family.
Yep.
And it's the same insurance that we have.
Yep.
And so that is a really good opportunity, I think, to promote that idea that somebody, that is retired, still healthy, and
Mhm.
maybe has some background, but if they are in need of insurance, that's a really good thing.
Yep.
And I think that we are moving forward, and I'm glad that we are here. We have the cities with us, and to have the knowledge of where we can work together and try to come up with a better plan and keep pursuing some more, and hope that as we go to legislature and tell our sad story. We have small county and we have large county, and they always talk about the problem with the large county and the small county. One day I got up, I said, okay, what we do with this small county, because we
Yeah.
have big and small in resources. And so anyway, but thank you everyone, and thank you for all the service you do, and thank you for being here, all you mayors, and we'll make it work. And we appreciate you guys being here, and appreciate all you do. And like I said, we don't want you guys to be worried who's going to pay for this ride, or who's going to.
Oh, that's one other thing I was going to say. I think we're going to see that on the next. It didn't pass this year, the Balanced Billing Act, which is another just stab to the heart. I don't say that I don't disagree. I don't disagree with it. I don't feel like the burden of these bills should be placed on, the end user. to pick up what the insurance companies should pick up. But similarly to what they've done the last couple of years with the air ambulance services, they are no longer allowed to balance bill. I believe it's going to pass most likely in the next legislative session, which would kind of eliminate the need for our or the availability to go after anybody whose insurance is paid. So hopefully we'll get the insurance companies to step up a little bit and offset some of that, but that's unfortunately coming as well. So we think no good news.
Any more comments?
No? Do you want a motion?
We have a motion to adjourn.
I'll make a motion to adjourn.
Oh, Commissioner Harvey, some comments.
Yeah,
Okay,
I'll second, but I do have some questions.
okay.
Maybe we can explore. I'm assuming that when we're coming together to look at numbers, what we're looking at is just hard numbers on total responses and like volume for each city. Have we ever had a conversation about payer type for the public? I'm just curious. I imagine a majority of the patients that EMS deals with might be uninsured. Is that typical? Is that kind of the pattern?
Need help?
Uh-oh.
I think they need help.
No, I have to go to work after this, sorry. What? So going to work after this, sorry.
They need a helper. That's a good demonstration.
What city is that?
I think a good answer to that question, Commissioner Harvey, is San Juan County unfortunately is roughly 60% Medicare Medicaid payer mix, and about 20% private or self-pay, and then the remainder commercial. Commercial insurance is where money's made in the healthcare industry, not in self-pay or Medicare Medicaid. So that's another, this goes back to the discussion of the whole Class 4 county, that we may be Class 4 in size, but we're definitely not Class 4 in the demographics of what we see, especially when it comes to payer mixes.
Yeah. Another thought that I had was we've been with this payer collections agency. The county has been for how long? How long has it?
Collections or the
JCI?
JCI, the billing company.
As long as I've been here.
Since its creation, and so
Have we ever examined
yes.
We have definitely
what they're looking for and
what they're looking for.
what their collection efforts might be? Like what are they billing for that's
The process, you mean?
well
In my opinion on that, with Jeremy saying that we're paying them $17,000 a year on $1.7 million billing revenue, that's pretty impressive. I've reached out to other counties, other cities. JCI is the go-to person in Utah for
Everyone who leaves
EMS
comes back.
Yeah, there was another company out there that we had explored. I know Grand County shifted to that other vendor for a small little while, and
Yeah,
And
they've
realized-
3 vendors in
yeah.
the time we've been.
they realized that wasn't the way to go and shifted back to JCI. So they've been vetted by multiple EMS.
Wasatch County did the same thing, and they do thousands and thousands of calls a year.
okay. Well, the only thing I can suggest is we just keep meeting. I'd like to see more UNHS Navajo Nation in the room just to hear what they're seeing. I know Indian Health Services, but you have to be a hospital. I know UNHS gets what they call chef monies. That's for like catastrophic. I forget what the acronym stood for, but it's a limited funding amount and it depletes. And I don't know what those funds are specifically for and if they're EMS, but I mean, we have a lot of little, we all have our own EMS systems, and if we continue to have more dialogue about the processes maybe they're doing, somewhere it has to align, in my mind, is what I'm thinking. And it's going to take some time, but yeah, thank you for making the time to be here and to talk about this. I'm sure it might feel endless, but you know, planning and working through the challenges that are there, I think at some point there will be answers, because we're all operating in our own spaces and we don't seem to share enough. And the more we can share, I think the greater chances of us
And
finding something different and unique.
I think it'd be a good idea even to invite them once just to know what their issues are, so we can compare notes and in what way we can probably work together. And I think that's a really good idea, and I appreciate your thoughts on that, and appreciate all your thoughts. And we do have a motion and we have a second, and all in favor say aye.
Aye.
Aye. So with that.